By 3 weeks after surgery, we'll have you come in for your first post-op visit. We'll take a good look at the incision, make sure everything is now healed without any signs of infection. We always obtain x-rays as well to make sure the implants look like they're healing appropriately. At the 3-week point after surgery, patients are starting to get back into their normal motion of the spine. It's a lot more comfortable now to move around as compared to immediately after the surgery. By this point, most patients are also off all the narcotic pain medicines, and this is when we'll start the outpatient physical therapy process. So by 3 weeks after surgery, most patients are going for a walk 2 or 3 times a day in their neighborhood. And the range of that walk varies. Some patients are already up to 2 or 3 miles a day. Others that are not as in good shape going into surgery may not be doing quite as much, but we do encourage walking quite a bit. This helps the body with healing and the nerve healing, as well as prevents complications such as constipation or blood clots.